Hello everyone. I am just waiting for Dr. Ruhi to join us and we'll begin the session quite soon. Hi everyone that is here today. Welcome to another live session with us today, and we'll be just waiting for Dr. Ruhi to join us, and we will begin soon. Um, Anybody who has any questions to ask Dr. Ruhi about? Oh, I think she's here. One sec. Yeah. So saying, anybody who has any questions, please put them in the comment box or the question box, and we are good to go. Hello, hi.
Hi, how are you?
I'm fine. How are you doing?
All good, all good. Thanks for having me today.
Thank you for coming. So let's begin with our questions.
Yes, sure. Whenever you're ready.
Okay. Um, Please tell us something about yourself.
Okay, I'll speak. I'm Dr. Ruhi Satija. I am a psychiatrist, counseling therapist, and a mind wellness coach. I am currently based in Mumbai. I have my own clinic as well as I am associated with Cloud9 Hospitals, which is a maternity hospital chain in India. And I am the perinatal mental health expert there, where I work with women with perinatal mental health issues, of course, the postnatal as well. And because I work with gynecologists, so breast cancer is something that, I come across on a daily basis, and I do treat patients with suffering from breast cancer along with the mental health issues as well.
Correct. All right. So today, since we're going to be talking about a very sensitive topic, that is breast cancer, suffering from it can take a toll on one's mental health. So, since you are the expert, we would all, I'm pretty sure we would all like to know if breast cancer and mental health are interconnected.
Right. Right. Okay. So that's a beautiful question to ask, and there is no one clear answer to it. Okay. Biologically speaking, of course, that if you have breast cancer, that does not mean you are going to have mental health issue, but definitely biologically you become more prone to get mental health disorders whenever there is any form of trauma in your life, or there is some incident that is difficult, and cancer is one of the most difficult diagnoses to have. So definitely it increases your chances of having various mental health disorders, for example, depression, anxiety, generalized anxiety, panic disorders, PTSD even. So it is not one that, can happen. It can be any of these or either of these, or sometimes one or two can be together as well. That's one
Okay.
aspect of it. So breast
Okay.
cancer can lead to mental health disorders, or it is also possible that if you have had a history of mental health issues, a diagnosis like this can aggravate that situation, or increase
Right.
that severity of that as well. So it can go
Mhm.
both ways like that.
Okay. So, what are the early signs and symptoms of depression in patients, and what should they look out for?
Right. So, for example, if somebody who does not have any other diagnosis can have similar
Hmm.
symptoms of depression, but when we talk about someone who is having breast cancer, some of the symptoms can be very overlapping, and sometimes they're very, overshadowed by the symptoms of breast cancer. For example, if someone has cancer, does not yet have depression or anxiety, might also complain of insomnia, right? Sleep disorders
Right.
or appetite changes. With the treatment
Hmm.
that comes with the breast cancer, that itself can cause you to lose some appetite, and also it sometimes, the is not very clear also that there is
Okay.
some mental health issue going on. And most of the
Hmm.
times that I see that patients take it as just a consequences of the diagnosis instead of understanding
Hmm.
that there is really a mental health disorders now starting, right? So that's something that to be very, very mindful of. With the awareness, with time, I have seen that even I am called a lot to talk about these topics with the gynecologist, because it's not
Hmm.
necessary that the person will come to a psychiatrist. The first point of contact
Right.
is always the gynecologist, or the oncologist who are treating them. So basically understanding, and even physicians, for example, so somebody who has breast cancer will not directly go to an oncologist. Maybe it's,
Right.
it's the family physician who is diagnosing them first, or
Hmm.
it's the gynecologist that's diagnosing first. So sensitizing them and helping them understand this disorder also helps. But some of the subtle signs, of course, start with sleep issues, start with eating disorder. Sometimes it is, sadness, crying spells. Then there is a lot of
Hmm.
thoughts of negativity, hopelessness, worthlessness involved in this. That is for depression. Now, it can be overlapping with some anxiety symptoms as well. So it's not necessary that
Right.
anxiety disorder has to occur. It can very well be a part of the depression symptom as well, that you have, a subtle anxiety or that nervousness going on, that something can go wrong. These also become a part of it. And of course, if it goes to PTSD and all other disorders, we have those flashbacks, or, the nightmares of maybe the day you got the
Hmm.
diagnosis. Or sometimes, they have these imagination of what will the life look like if something happens to them,
Yeah.
what happens to their kids, what happens to their families. So all this negativity and all these negative thoughts tend to overwhelm them, and tend to, they tend to overthink about it. So these are some of the
Correct.
subtle signs. Only thing you need to know when it is a problem is when you're trying to shake it off but you're not able to. That's the easiest
Hmm.
way to understand when it has become a mental health issue. That, see, every one of us, each one of us do get these negative thoughts on a daily basis, right? All of us
Right.
can say that at some point of time we didn't sleep well or we didn't feel like eating. But if it becomes a consistent problem and you're not able to overcome it, that's when it is a problem, and that's when you need to
Hmm.
see a professional.
Okay. All right. Um, what is the treatment for anxiety in people dealing with breast cancer?
Right. Okay. So that's a wonderful question. Why I say that is because whenever it comes to mental health treatment, there's a lot of bias, especially when it comes to the medications. And then if
Hmm.
someone has cancer and they're already undergoing chemotherapy or some radiation therapy, they're already
Hmm.
undergoing so many side effects that taking one extra pill, that to a psychiatric medication itself
Yeah.
can be very traumatic, right? But we need to
Right.
understand that the first treatment is never medication unless it is required, right?
Hmm.
Because we are already dealing with a lot of medicines when it comes to cancer. It will never be that the first thing that we tell that the person is that, just go home, take these 5 pills and you are done. Never
Hmm.
like that. We always start with what are the factors that are involved. So yes, we get it that one thing is a diagnosis, but then what is it that's making you anxious? It is never just a diagnosis. It is also,
Right.
the possibility that the patient sees for themselves, the worry that they have, or, the anxious concerns that they have, whether it's about their life, whether it's about their family. So all these factors add up. And of course, sometimes there's a lot of anxiety about the treatment itself, because we read a lot what chemo can do, what radiation or what
Yeah.
surgery can do to a person. So there are a lot of concerns. So when it comes to treatment of any mental health disorder for that matter, it always, takes two parts. One thing is, of course, the medications, if and when required, depending on the severity of the symptoms and the type of symptoms that you have. In some cases,
Hmm.
it might not be even, suggested that initially we start with an antidepressant directly or anti-anxiety pill directly.
Okay.
Maybe we just start with symptomatic treatment. That if you are having a panic attack, if you are having an anxiety attack, you just take a pill to help you in that moment, and we don't start anything else, right? So it's not
Okay.
necessary, and the judgment is made based on, the clinical aspect of it, seeing the patient, seeing the history, seeing the other treatments that the patient is having.
Right.
So it is a very, very complicated decision made in a, very subtle way of understanding the clinical aspects of it. But apart from medications, we have a plethora of treatment. For example, therapy, right? So
Hmm.
for PTSD, for anxiety, we have similar symptoms. So therapy works wonderfully well. First of all, of course, you get somebody you can talk to without any bias, without any judgment, without even feeling that, that maybe I can say this or not, because this person is not directly connected to you. So, there are always, it's easier to say things to them rather than your own family members, where you will have some bias or you will
Yeah.
have some limitations of, I cannot tell this to my partner or my kids. That's one thing. But that's not all. I think with people, the biggest misconception is that this is what therapy is. We talked to someone and we went out and
Yeah.
that's done. That's not true. So when we talk about depression and anxiety, one of the techniques that we use is CBT, for example, cognitive behavioral therapy. Especially with breast cancer, we work a lot with mindfulness as well. So, mindfulness based CBT, which is basically helping them, coming back to the present moment instead of worrying about the future or having some ruminating thoughts, or worries, or some regrets or resentments they have of the past, which now is making them feel stuck in the moment. So we help them challenge those thoughts, change those thoughts. It's literally working on the mindset and changing them. So it's a complex procedure made
Mm.
much more simpler if you are with a therapist, right? So
Right.
treatment is not just about, popping some pills and that's it. You get a
Mm.
professional, start with therapy, meet them, share your concerns, work around them so that you are sorted. And of course, apart from that, there is something called as lifestyle modification that is a part of any, medical issue, where, we work towards the stresses in life. So whenever we talk
Okay.
about mental health issues, it is biopsychosocial model. Bio means whatever the biologically went wrong, which
Mm.
caused it. Psychologically, whatever your thought patterns, your personality issues are. And then sociological, which is, your family, your members. If there is some
Mm.
issues, maybe most of the people complain about maybe family members not treating them the way they would have expected.
Yeah.
There are some feelings that way. Otherwise, even if they want to, they're not able to because of certain
Mm.
limitations. There are financial aspect to this diagnosis because it is a very expensive treatment. And of course, the sheer tragedy of this treatment itself takes a toll.
Yeah.
So
Of
working on all of that and helping them, recover from all of this. It's like a 360-degree approach that we take. So
mm.
this is how we treat a mental health disorder in any case. But of course, when it's a cancer diagnosis involved, there are a few more steps and there are a few areas that we cover. Apart from, and in many cases, we also take care of family therapy where we involve the caretakers also. Many people don't
Okay.
realize that the cancer diagnosis is not just about the patient. The family
Mm.
gets affected as a whole,
Yeah.
right? And many times it is seen that it is not just the patient which gets a mental health issue. The family members can get depression. The family members can get anxiety
Right.
disorder. So not forgetting them, right? Also
Mm.
taking care of them, getting them involved in the process, helping them understand how they can help the patient in a better way, helping the patient understand what they should be expecting from the family members at this point of time, to make the process a little bit, as much easier as possible. Of course, there is no way to minimize the tragedy of the diagnosis,
Mm.
but definitely I always feel that, pain is inevitable, but suffering is optional because we cannot
Mm.
escape the truth of life. There are incidents which will be very unfair, but then how much we suffer from it should be our choice. Although in most cases it feels like it's not, but then I think we can work on ourselves and at least make it a little better. That is the idea.
Right. That's very well said.
Thank you. Thank you.
Yeah. Can breast cancer cause body image issues too?
Yes. So that's a thanks for this question actually, because I
Mm.
think very few people talk about this. Breast cancer, uh, and not just in youngsters. Whenever it
Mm.
comes to body image issues, we think that it is the youngsters that get affected, right? Body image is often associated with a teenager or,
Yeah.
the Bollywood and all
Right.
this modeling industry, but that's not necessarily true. In fact, one of the major concerns that I see with females is that after they have their mastectomy surgery, once the breast is removed,
Mm.
it causes a major havoc because, breasts are something that we identify with. It is a part of
Correct.
being a woman, right?
Yeah.
Although I feel that because this is a learned thing, I feel that we should be, taught that this is not just who we are. But
Mm.
unfortunately, with a major section of my patients, I see that they are concerned about that. In fact, just 2 days ago, I had this patient who shared this that, I have had such a lovely marriage. We have been married for 30 years now. And now I feel that now that this has happened to me, my husband will lose interest in me. And then, he would just
Oh.
maybe go out and stay around. The husband was sitting there, and I remember she was very strong. She came in, she was strong, she was talking about the depression that she had. And the moment she said that, she broke down. And that was such a, vulnerable moment to be in and to be present with that
Mm.
family. The husband was right there and he was like, I can't even think of doing something like that. But imagine she never said this to the husband till now.
Yeah.
It's been 1 year almost since she got diagnosed. She got better. Her treatment of cancer was over. Now she got depression. And now she had these feelings. So it is not just limited to the teenagers, and it is a very, very viable and palpable problem that we see in cancer patients, right? So yes, it
Correct.
can cause that, and the treatment is again therapy. And sometimes, if it is a part of, if it is just body image issues, it is primarily therapy. If it is associated with anxiety and depression, of course, we talk about medications in that case.
Correct. So, sorry to break you, but anybody who has joined in our live right now, I just want to mention that any questions that you have for Dr. Ruhi, we'll be answering all of them at the end of this session. And you can put them all in the comment box or the question box, and we'll move forward from there. All right.
I will answer one
Um,
question that I actually got in my DM after someone saw this post, and of course, I won't be naming that person. The name person is live, so I remember that I have to answer this question. So it was a
sure.
beautiful question of that there is a family member in in their family there is a history of cancer. The first question was whether
Okay.
there's a chance that they can get breast cancer as well, and the second aspect was that she already suffers from anxiety, and the fact that now she got to know that somebody in the family has breast cancer, it's a first family relative, her anxiety has gone overboard. So I would like to answer this, although she does not have breast cancer, but because this is a common thing that I see as well, I would like to say
Right.
a few words till the time people can throw the questions.
Sure.
So yes, if you have a family member, if it is a first blood relative, your chances of getting cancer definitely rises. But that is why we suggest that every year everyone should get a mammogram, and it's a humble request for all of you that anyone above the age of 30 at least, of course if you are earlier very young age, doctors don't recommend it, but above the age of 30 it is very very advisable. Everyone should get it, but if at least if you have even one family member having this diagnosis, it's better that you get a mammogram done every year at least once. That's the first thing. Second thing is that yes, just with any anxiety disorder, like this is a traumatic event for her, it is her first family member, her aunt actually, who got diagnosed, and that has provoked a sense of panic in the family, and she was worried
Right.
that she might get it. So my answer to that would be, and also this is an answer to the caregivers, right? Because you are taking part of that. So again, I would suggest that you cannot help somebody else if you are not helping yourself. Even in the flights, they tell you to put the mask first and then to your baby.
Yeah.
So if they are asking you to prefer yourself over the baby, and I hope you can understand what I'm trying to say. You cannot pour from a half cup, right? So take care of yourself first, and this is like, it can be like a PTSD only in her case as well, that she went through some
Right.
trauma which she is not able to deal with. So get yourself checked, get yourself assessed from a mental health professional, and start treatment. Like she said, in her I didn't see a lot of physical symptoms, so definitely she wouldn't need the medications, but I would really suggest that get a proper assessment done and at least start therapy. And the whole family can come for, one or two sessions where they can share what they are feeling really, because in the family setup, they are not able to do that. But in the presence of therapists, it becomes much easier to talk about the
Yeah.
things that are otherwise
Right.
difficult to talk about with each other. So that is my answer to you, that, there's no point in suffering from something for which we already have, treatment available, or we have resources available. And right now, with the beauty of mental health, I think the only good thing that I saw in COVID was that all these professionals came online. So it doesn't matter which
Yeah.
part of the country you are in, can literally reach out to the person that you feel that you can trust and just talk about it. And they have this bias that they'll go to a psychiatrist and the medications will start. That's not true. We are going to recommend what is required, and you're open to go to 5 more psychiatrists if you don't agree with the first one, and then make a choice.
Right.
But at least walk out. If you are suffering, just go out, ask questions, seek some form of um, output that you can find, and some form of outlet that this is the possibility for you, because there's no point in suffering for even a single day longer than it is required. We cannot, like I said, we cannot remove the pain in your life, but we can definitely help you overcome that a bit much faster and reduce the sufferings. Just go for that. I saw that person online, so I wanted to answer the question.
Yeah. Surely,
Yeah,
surely. All right. So, going back to how you're talking about the family of the person who's affected by breast cancer,
right,
how can the family members deal with a person who is suffering from breast
right,
cancer? How do
right,
they take care of them?
right. So see, dealing with the family members, they have to do two things. One thing is deal with the patient, and then deal with
Hmm.
their own fears, right? So you need to understand that, of course, upfront you have to be strong and be there for the person. So the only thing that you need to do for the patient, the first thing is avoid advices, right? That's the worst thing that the people do, that you should have done
Hmm.
this, you should do this
Yeah.
will work, and always advising some weird herbs and medicines some baba has given. That's the worst thing that you can do. It doesn't work, and all you're doing is help making the patient stay in that denial mode or that angry mode even longer. The
Yeah.
sooner they accept that they have something to deal with it, and the sooner they deal with it is, they'll get over. Because in the initial stages of, doesn't matter which cancer it is treatable. We have wonderful medications and treatment as well. So do not do that. Do not make it even more difficult for them to decide what is the right thing to do, right? Trust your doctors. If you
Right.
don't like that doctor, just change another doctor, but do not deny the treatment. That's my answer, right? And with the relatives as well, I understand how difficult it is. It is not just an emotional trauma, it is a financial, physical, social trauma. Everything just shakes. A cancer diagnosis literally shakes a
Yeah.
family, right? So make sure that you are taking care of yourself, right? Also, one very subtle advice, but it is really important, that once you get the diagnosis of cancer, everything becomes about it, right?
Yeah.
That's all we talk about. That's all the relatives
Yeah.
want to talk about. They want to need the updates. They want to ask what happened, why it happened, what is the going on, what is not going on. So maintain
Yeah.
healthy boundaries, right? There
Correct.
are a few people with whom you need to discuss your diagnosis and treatment. Do that. With other people, maintain your boundaries. Stop them. Tell them that you are not up for it, because talking about the same thing is only going to traumatize you, right? And even with the family members, the first thing I tell them is that maybe just have a separate worry time, maybe half an hour a day, just keep
Right.
for just talking about this, and rest of the time, don't do that. Just think about other
Hmm.
things, because that person should not be reduced to a cancer patient. That's a
Yeah.
viable, heart beating human being. So do not forget that, that they have so much more to offer than just a diagnosis. So do not forget
Correct.
that. Do not make everything about cancer. Talk about it when they want, as much as they want, but not more than that. We always have our own, and it comes from love, it comes from sympathy. It's not that they are doing it to hurt the person or make them feel a certain way, but sometimes love can be a bit toxic. So make sure that you are maintaining those boundaries, and also not forgetting throughout the process that because you are the caregiver, you need to take care of yourself first. Do whatever
Right.
it takes. If it requires exercising, talking to people, finding a therapist, finding a psychiatrist, whatever it takes, just make sure that you are okay. You do not lose yourself in the process, because the other
Hmm.
person needs you much more right now. So only if you have the resources you can provide. So start with making sure that you know that you are okay, and if you are not, making sure that you have the resources to deal with this problem, and don't do it alone. That would be my advice.
All right. Okay. And what? And lastly, what piece of advice would you like to give to the people listening to us today?
Yeah, so there are a lot of advices that I can give a patient, right? The first thing is, take your time with understanding what
Hmm.
has happened. Okay, many times what happens is a state of panic comes the moment we see the diagnosis, right? My suggestion is, of course, as soon as you feel that you are panicking, maybe finding a therapist at that time only is
Hmm.
the best strategy, of course. In fact,
Yeah.
this is only not in India. If you see US and the better countries, the first world countries, the moment you get a diagnosis like that, you are appointed a therapist to deal with all
Right.
of this trauma simultaneously, because it is a
Okay.
difficult thing to deal with. So that's the best thing you can do. But of course, in India, things work very differently.
Yeah.
Second thing that you can do is, don't make assumptions, right? The moment we hear cancer, we just think of the worst case scenario, right? So
Hmm.
don't do that. Listen to the doctors, see the level, the stage of cancer that you are in. Just get the facts right. Do not Google it. Do not check it on, some sites which are just, fake, and sometimes not even written by medical professionals. I know how many times I get these calls that will publish an article on your name. Can you just check it once? And I always tell them that, if I write it, you publish it on my name. Otherwise, don't do it, because I
Yeah.
don't know who the person is who is writing, and I don't know where it's going, right? So get your information from credible resources. Get your information from the people who actually know what they are talking about, right? The simple example I give is, even though I am a doctor, it seems that I am intelligent. Let's say you have a banking problem, you're not going to come to me. Doesn't matter how
Right.
intelligent I am, right? So
Yeah.
similarly,
Of
if you
course.
have a medical issue, don't go to anyone else, right? And
Hmm.
also, if it's a cancer diagnosis, do not take opinion from me. I am a psychiatrist. Don't ask me. Ask your oncologist. But if it's a mental health issue, come to me. Don't ask your oncologist, right? So be very, very clear of where you are taking the information from. Who are you trusting more in this aspect? That's very important. Third, like I said, before making assumptions, get your facts right. And then once you know your facts, get it sorted into what you can possibly do and what is it that you need to go, right? Many times what happens is people try to do everything at a time. The moment they get a
Right.
diagnosis, they want to get their life also tracked, they want to start
Yeah.
exercising, they want to start eating healthy, they want to take care of the family, they need to make the financial decisions, etc., etc., which itself can cause so much stress. And we all know that if you have a positive mindset, your chances of recovering increase a lot, right? So make sure
Hmm.
that you have that breathable space in your life when you're not doing anything and actually enjoying life, because that is something that will help you healing more than whatever you
Right.
do, right? So we see on the window that fly keeps on banging, right? It doesn't
Yeah.
lead to anywhere, right? She's still just staying stuck. So don't do that, right? Take a deep breath, sit with yourself, sit with your family members, have an actionable plan ready, sit with your doctors, make a strategy that you would like to do, and take breaks. Do not forget to live. Even through tragedy, no one has said that just because something difficult has happened, that's all you do, that you just cry and you feel
Yeah.
upset about it. Like I said in the beginning of the session, a diagnosis is just a diagnosis. Like everything else, it's a part of your life. It is not who you are, right? A
Right.
cancer patient is a number for the doctor. For you, you're a whole human being. So don't do that to
Correct.
yourself. Make sure that you have space, a little bit space for breathing as well.
Hmm. All right. Those are all the questions that I have for you today. Let's move on to questions from the audience. So, anybody has any questions, please put them in the comment box or the question box, and Dr. Ruhi will be answering them. Okay. Is every breast lump a cancer?
I think there was some network glitch. Did you ask me something? I think I missed a few
Yeah,
seconds.
yeah, sure. I just said, is every breast lump a cancer?
Okay, no, not at all. And this is the biggest misconception. Okay, every
Okay.
breast lump is not breast cancer. Sometimes it is just a cyst. Sometimes it can be just an apparent growth. So better to get checked. And like we always talk about, okay, this is one aspect that I can talk about as well, which is very important, which is a breast self-examination, right? Many female I see that are very hesitant to do that, right? Because it feels, I don't know, intimate or something. It's very important
Yeah,
that at least
right.
once a month, you can simply go on Google and find this chart, or I can share it with you and you can post it in your Instagram
Yeah.
stories, that how to, check your breast every month once for any lumps in your body. It's a simple, like, few steps process, and you can literally stand in front of the mirror and do it. Please do it, because, the earlier you find it out, the earlier you get tested, the earlier you get out of treatment. That's all I have to say, right? So every lump is not, cancer. That's very important to understand. And the sooner you find that lump and get it checked, the sooner the better. So don't worry about it. Like I said, do not make assumptions, right? You see something, let the experts handle it. That's what they are. They have killed their 20 years of life to get those degrees and sit and do the job. Don't waste
Right.
20 years of your life. Just get it done from them. Let them worry about it. You just worry about being happy. Just worry about being healthy. Healthy. That's all. So that's
Right.
that's not true, and it's a big misconception. And one of the reasons of anxiety issues, they don't even reach the oncologist, and the anxiety starts before, because people are not aware of it. So don't think like that. And in fact, the ratio of it turning to a cancer or being a cancer is much less than it being a common cyst or something like that. So that's not true. Okay.
Okay. I hope that answers your question. Um, Anybody else have any questions for Dr. Ruhi? Okay, I think those are all the questions that we have for you today.
Sure.
Okay, all right. Thank you so much, Dr. Ruhi, for joining us today. It was a great time. I hope you had a good time, and everybody here is learning something new today.
Anytime they have any questions, they can just DM you. You can send me, or they can DM me. I
Yeah,
would be happy to answer. Just
absolutely.
don't suffer. That's all. Make
Absolutely.
it make
And
it
if
easier for
anybody
yourself.
has 100%. And if anybody has any questions that you missed out or you joined in late or something, please put them in the comment box of the live session. After this session, I'll be posting this session. So anybody who missed anything can 100% go back and see this entire thing. And I hope all your questions are answered. Thank you so much, Dr. Ruhi, for joining us today, and see you again sometime.
Thank you.
All right. Have a nice day.